Hi, I'm Harvey Target of Block 44S, and this is Flexural contractor, also commonly known as ballerina syndrome. So we'll start with a definition. It is a deviation of a limb on a sagittal section or sagittal plane. It is acquired. It usually appears around 6 months. It affects the superficial digital flexor tendon and the deep digital flexor tendon and the fetlock. So again, if you look at the limb, all that pressure here, ballerina syndrome, obviously, as the name suggests, it's when it comes up. So these are all tight, so the fetlock and the tendons, superficial digital flexor tendon down here, attaching to the proximal phalanx and the middle phalanx, and then the deep digital, which comes into the palmar process on the distal phalanx. Obviously these are all tight and they're pulling up. So it is located on fore and hind limbs, so palmar and plantar aspects. The heels are elevated, so basically how this is now. It can be a club foot. It can usually cause this in later life. It can be caused by the tendons forming too quickly. There will be excessive toe wear at the toe because it's obviously unilateral or bilateral. It can be caused by overfeeding, direct or repetitive trauma, rapid development of the foal, excessive movement at a young age. So obviously you'd start with your static and dynamic assessment of it. There'll obviously be a gait change, but obviously it's a foal, so you're not going to know a lot about its gait at this stage. Adverse hoof morphology, which also links to the sort of scraping of the toe. It can be diagnosed by radiographs. As a vet treatment, they might give it NSAIDs, so that's non-steroidal anti-inflammatory drugs. They might wrap the foot with support bandages to stop any bruising or any more sort of flexion from the joint, any more damage. Surgery, they basically can like almost cut the tendons that puts it to how they want it to be. There'd be broken back or short HPA. So you'd want to trim the heels down. So obviously the foot's sort of like this. Trim the heels down so it comes like this. Dorsal toe extension. So if you put a toe like this, you put an extension on, it's going to bring it like that. So it's level. Protect the toe. So you might even put like, so you say you put like a aluminium sheet on there as the extension. It's also going to protect the toe a bit. It's going to cover that, bring it down. Owners should cut the feed down. They should limit the exercise of the foal as well, maybe box us for a little bit. Prognosis would be favourable if caught early, but if not, it can have laminal changes if it's not caught early. Thank you.